for inviting me to speak here today about the Australian Medical Association, who we are and what we do. Before I get into the speech, I thought I'd tell you a bit about myself. So, as Kerry's already told you, I have an undergraduate degree in science, and as it turned out, it didn't really suit me. So after I finished university, I decided I needed to do something else. So I decided, I applied for a position with the management training program that was run by the Department of Health, the Victorian Hospital Association and major Victorian hospitals. And I was fortunate enough to get accepted into that program, and it gave me the opportunity to work with the CEOs and be mentored by the CEOs of the major public hospitals. And it was during this time that I actually met Heath at one of the functions organised by the Australian College of Health Service Managers. And it was also the first time that I came in contact with the Australian Medical Association. This formidable group of people would often come and meet with hospital CEOs to argue for the rights of doctors, and I have to say they left an impression of power and prestige. Anyway, I completed my management training program and spent several years in the hospital sector in various management positions. Moved into aged care, where I worked with the elderly homeless population, and then I was CEO of Mayflower Group, and eventually ended up working with a peak body for aged care providers, leading Aged Services Australia. It was while I was there that I was approached and asked if I would be interested in the position of CEO of the Australian Medical Association Victoria. And having seen the AMA in action throughout the years, I knew it was a position that was come with a lot of hard work, complex negotiations, public role, but that it was also a game changer for me. So, what is the AMA? If you ask someone off the street, they'll tell you that it's a union for doctors. If you ask the government on a good day, they'll tell you that we're a lobby group. If you get them on a bad day, they'll tell you that we're there to represent those greedy doctors who are only in medicine to make a buck. So the AMA is some of that and more. And I say some of that because despite being referred to as a union, we are not registered with Fair Work as a union, and doctors don't like to be unionised. We are the only association that represents the entire medical profession, from medical students right through to retired doctors. And our vision is to shape the future of health in Victoria. AMA Victoria was originally known as the Port Phillip Medical Association and was established in 1846 by those first doctors who settled in Melbourne. Those 4 doctors formed the association as a support network and for educational purposes. Over the years, the name has changed several times until it became AMA Victoria, and the role of the organisation became increasingly broad. Our role is so wide and varied that I thought I'd draw on the objectives stated in the AMA Victoria's constitution to give you an overview of some of the work that we're involved in. While there are many objectives, I thought I would focus on those that keep me the busiest. So, the first objective that keeps me busy is to promote, maintain, advance and extend the honour, interests and standing of the medical profession. It's our role to protect the role of the medical practitioner. Each year, our policy units consults with members of submissions we compile to government inquiries. There are so many inquiries and discussion papers that affect medical practitioners that it's a core component of what we do in representing doctors. Recent submissions include the supply and use of the drug ice in Victoria, task substitution, APRA, which is another name now for Medical Board, guidelines for practitioners with blood-borne diseases, our state election manifesto, that is what we want major parties to commit to, and our state budget submission, which is what we want the government to invest in. And these are only the Victorian inquiries. On a federal level, AMA submissions have included the GP co-payment, which of course everyone will have read about in the papers, the Senate inquiry into healthcare expenditure, and the inquiry into self-harm and suicide in children. So you can see policies and lobbying is implicit to promoting and protecting the medical profession. The next one that keeps me busy is to be the forum for consultation for the medical profession. The AMA is where governments of the day come to when they want to consult with the medical profession. While there are many splinter groups around, as I said earlier, we are the only organisation that represents the entire profession. Advanced care planning is an example of where the government has conducted extensive consultation with the medical profession. An advanced care directive is a document made by a competent person stating directions about their future medical treatment that are to be followed in the event that they are no longer capable of making their own decisions. They usually appoint a substitute decision maker and detail preferences about health, personal care and preferred health outcomes. Advanced care plans promote autonomy and dignity and reduce the burden on state-supported substitute decision makers. There is no Victorian statute associated with advanced care directives, and common law is unclear. This has led to legal uncertainty and confusion within the medical profession as to whether doctors and other healthcare professionals are obliged to follow these directives. As advanced care directives are not legally binding, doctors are potentially exposed to legal action for negligence if they respect a patient's wishes and offer no treatment, or by a patient who was treated contrary to their advanced care directive. So that's a bit of a no-win. Our members have overwhelmingly stated that they want us to seek amendments to legislation to protect the treating practitioner and to ensure that the patient's wishes are upheld. AMA Victoria is lobbying for these changes and has also been funded by the Department of Health to establish guidelines for health practitioners to discuss advanced care directives with patients. In this regard, we are the forum for consultation. The next one is to take an active part in the promotion of healthcare programs for the benefit of the people and to participate in the resolution of major social and community health issues. Now, this area takes up an extraordinary amount of my time. A third of our state election manifesto is dedicated to issues surrounding public health, in particular alcohol misuse and tobacco reforms. Alcohol is a major issue. A snapshot survey conducted in December last year found that up to 1 in 3 presentations to emergency departments in Australia and New Zealand were alcohol related. Similarly, a survey released last week by the College of Emergency Physicians found by over 2,000 ED staff in Australia and New Zealand found that 98% had suffered verbal aggression from drunk patients in the last 12 months. 92% had experienced physical threats from drunk patients in the last 12 months. And 87% said they felt unsafe due to the presence of a drunk patient while working in the ED. They're not good statistics. In Victoria, we would like to see a reduction in alcohol promotion and advertising. Its association with AFL and cricket and kids sporting heroes has to stop. So does the bulk 2-for-1 wine deals on all supermarket receipts. Research undertaken by the Centre for Health Initiatives at Wollongong University and the Cancer Council found that children who regularly see alcohol advertising are more likely to start drinking at a younger age and drink at harmful levels as an adult. And the more alcohol advertising a young person sees, the more alcohol they're likely to drink. Drinking from a young age damages the human brain and increases the risk of having alcohol problems as a teenager and an adult. The AMA lobbies hard for alcohol reform and harm minimisation. And when it comes to tobacco reforms, We must keep going. It's hard to imagine that smoking was permitted in the MCG up until 1999. Presently, Victoria is the only state in Australia that has not committed to a date to ban smoking in outdoor dining areas. This is not good enough, and we will continue lobbying for this until we are given a firm date. Some people are against the AMA's push in these areas with remarks like, nanny state and wowsers often thrown our way. However, the AMA is strong in its convictions when it comes to health policies like tobacco reforms and minimising alcohol exposure. Our stance on this issue is no different to our position when compulsory seatbelt wearing laws were introduced and came into effect. At that stage, people were yelling freedom of individual choice. And now you just wouldn't consider getting into a car without wearing a seatbelt. So attitudes change. And so do life-saving measures like that matter. The next one is to consider and advise on any issue of medical and health policy. Governments of the day often ask our advice on medical and health policy, and we're constantly being asked to advise on issues such as ensuring health services prepared for heat waves, hospital expansions, ensuring growth corridors have appropriate health services, e-health, mental health, paediatric services, and the list goes on. An example of where we've been successful is following a long campaign by us, legislation was recently passed which will mean harsher penalties for people who assault emergency workers, including police, paramedics, doctors in emergency departments and other emergency response workers. And this change was sorely needed. The final one, which is the one we're most known for, is to provide industrial advice and act on behalf of members in industrial matters. Now, one of my staff is here today, so I have to say good things. But anyway, he's IR too, so. This area is what we're known for, and I'm proud of the fact that my team has been able to negotiate an enterprise agreement which went through quietly and had fantastic outcomes for our doctors who work in public hospitals. Our agreement is the benchmark for the sector and was negotiated without angst on either side, and Andrew played a role in that. We have a strong legal and industrial relations unit which helps our members with all things from contract reviews to questions such as how long do I need to keep medical records for? And sadly, as with many workplaces, bullying and harassment also comes into member representation. We are the group that doctors call first if they have any problems with their employment, their training, or their rights are being eroded. It is our responsibility to represent the doctor. So these are the 5 key objectives of the AMA. And what they really boil down to are 3 pillars. And they are advocacy for doctors, advocacy for patients, and advocacy for the community. It's my role as CEO to ensure our strategies, our businesses, our direction and our actions advance the organisation. While it is the Council and the Board which dictates AMA's medical views, it's a responsibility of me and my staff to ensure that AMA progresses, expands and remains powerful. Complacency and poor strategy can affect every business. So that's my professional career. But I'm extremely proud of my family. My husband and I run a chaotic ship where we both work in demanding jobs and we have 3 children aged between 7 and 14. We prioritise and we make sacrifices. It is fundamental that you always take care of yourself and your loved ones, or it'll all come crashing down. It is of course challenging and sometimes I want to pull my hair out, like the recent time when I went to work one morning having had no sleep because the night before my teenage daughter had had a slumber party and I had 6 girls squealing and laughing until dawn. But for me, my career success has been fuelled by my enjoyment of the sector and I'm in and the companies that I've worked for. There's no such thing as a perfect job, but great jobs rely on 3 things: the right role, the right sector, the right company. And if you get all three, you're on a winning ticket. Thank you. So the question was, what's the answer to drunk patients and alcohol? It's actually alcohol minimisation, so restricting access to alcohol. That's right, you're right. You can't do much once they're already drunk. But what's happened in New South Wales is they've introduced a number of measures whereby it's increasingly difficult to get alcohol after certain hours. So last drinks are at 3 a.m, whereas here in Victoria you can buy alcohol 24 hours a day. Packaged liquor, so if you go and buy mixed drinks, that's closed at midnight. You can't buy anything after that time. So it's restricting where you can purchase alcohol will reduce the number of presentations to the emergency department.
This is a bit personal, so forgive me. A family member was taken ill last year with what proved to be a very difficult diagnosis, taken to emergency public hospital. When they found out that she was privately insured for hospital, moved immediately, literally across the road to the private hospital. And there she endured a very unsatisfactory series of treatments and sort of day-to-day poor nursing, etc. But her consulting doctor was the worst. I think she saw him once when she was delirious. Now, we are having an ongoing fight with the hospital about all of this, so that's by the by. But what astounded me when I contacted Health Services Commission was that they said the doctor had no responsibility to the hospital, and that this is presumably what visiting rights mean. The doctor is simply still an autonomous person. How does the AMA get somebody like that to adhere to reasonable standards?
That's not actually the role of the AMA to get them to adhere to reasonable standards. That's actually the role of AHPRA, which is the Health Regulation Agency. So another avenue that you could take with your complaint is actually to lodge a complaint with the Health Regulation Agency. And if they believe that there was any professional misconduct, then they would deal with it through their mechanisms.
So that in the meantime, the people concerned, who are, so to speak, the victims, still have to fight the doctor as an individual and do it that way.
Well, I don't know the case, and it's difficult for me to comment in this instance. But that you've gone to the right place. It's the Health Services Commissioner, and the other one I can recommend is AHPRA.
Thank you.
Thanks, Kerry. Early on in your excellent talk, you mentioned the question of blood-borne diseases, which is a topic that I'm interested in. Can you tell me what the issue is in your hands and what you're doing about it?
So the question is around blood-borne diseases. AHPRA's launched an inquiry into how to deal with doctors who have a blood-borne disease. So we consulted with medical professionals who are experts in this area, and we've put our submission in, but there's been no outcome to the submission at this stage. I anticipate that'll come out in the next few months. So if you give me your details, I'm quite happy to email that through to you once it comes through.
What do you see as the prevalence of the problem?
Well, there is no prevalence. It was a knee-jerk reaction to... There was an incident that was reported in the papers about the... can you remember what it was? Dentist in Gippsland, that's it. Sorry, I was thinking about the other. Yes, so, and they launched...
Sorry about that.
No, it's all right. So they launched this inquiry as a result of that, but that dentist, as it turned out, had actually acted in a highly professional manner and hadn't done anything incorrect. and we supported the guidelines that are currently in place.
Currently, the Age and probably other chambers are running a campaign about assisted death for the terminally ill. When will the AMA stand up for majority opinion on this issue?
Controversy. We've been asked about assisted death and when will the AMA stand up for opinion, public opinion. The AMA is actually here to represent doctors on this one, not the public, unfortunately, or fortunately, whichever way you want to look at it. So the AMA's position is that we're against physician-assisted suicide.
Be nice, please. A lovely guest who's been invited. She's the messenger. We're going to shoot our messengers, okay?
And she's not a doctor.
And I'm not a doctor, yeah, so...
Some doctors do, and they are being persecuted for what they do if it's found out. That's what I mean. There is a role for the AMA to permit their members to act according to their beliefs and help the patients who wish a certain treatment. And that's where I think the AMA does come into it.
Absolutely, except our members are telling us that they don't want to do it.
I know it's a fairly difficult issue for the medical profession. It's also a crucial issue, particularly for young people of our age.
The young.
Yes. I'm wondering when they're going to do something, because there are doctors who are courageous enough to look at the welfare of individuals rather than medical policy. Surely you have a job, a duty to protect them as well.
Well, they're actually breaking the law. So at the moment, physician-assisted suicide is actually breaking the law. So they can be charged with a criminal offence. So until the law is changed, we can't advocate that our doctors break the law.
Is the AMA advocating any change in the law?
Our position is that we don't believe in physician-assisted suicide. I just knew this was going to come up tonight.
I should have warned you all. I've got a question over this side.
Oh, okay. Thank you. So that's just, yeah, well, that's an organisation that I used to work for called Winteringham that dealt with homelessness and elderly people. So we provided aged care and housing for homeless people. Sorry.
My nephew suffered genetic disease which required constant hospitalization all through his 21 years of life. And the hospital in Winnipeg, Canada, where I come from, the whole room devoted to children with this nature. This was 40 years ago. But friends of mine who have not quite such a trauma find it difficult to get in the hospital. Is there any movement by the AMA to try and increase facilities for such children?
Not that I'm aware of, not that I've come across. Oh, sorry. This gentleman is asking me about facilities for I take very ill and disabled children. Is that correct?
Chronic illness.
Chronic illness. We haven't at this point taken that up, but we're always looking for new policy initiatives. But you know, what we do is we hear about what is an issue and raise it with our members, and then they debate whether they'd like to take that up as a policy initiative or not. But there are groups who do a lot of work in that area. I'm happy to discuss that with you later.
Oh, this is more a comment. Sorry, did you want to ask a question?
Ladies first.
Because I've had my say.
It's okay.
This is a couple of comments. Rodney Simon's been defying the law for years and still hasn't been charged. I don't believe any doctor should be forced to do things like an abortion or to help somebody along unduly to death if it's against their conscience. But I don't believe equally that they should stall you from seeing somebody else who will help you. And that's something I'd like the AMA to take on board. And the other thing that Dying with Dignity has suggested is that if the sort of thing they want does not get through legislatively, which I predict it won't, that at least be referred to the Law Reform Commission with some sort of undertaking that their recommendation will be taken seriously and acted upon.
Just with regard to your first point in terms of a doctor's conscience and referrals, we do provide advice to our members around that, and if they have a philosophical objection to abortion, for example, they usually have a sign up in their waiting room stating that, so that you know as a patient going in that you're not going to get that referral there.
But some people need more guidance than that. It's all very well if you're articulate, but if you're not articulate and think doctors still are gods, you need a bit more encouragement than being told we won't do it here.
We pass on to the next question. Oscar, please. Thanks.
You mentioned your state election manifesto. Sort of thing as a voter, I'm interested in what things are in your manifesto and what responses have you had from political parties to guide us as electors when we come to cast a vote. That's the sort of thing we should be aware of.
Well, tobacco, alcohol, as I said, a third of our manifesto. Hospital beds, we'd like to see more beds in growth corridors. We would like to see, just trying to flick through my manifesto now. Hospital beds, outpatient waiting list data, we'd like to see that published. So what happens at the moment is a doctor, a GP will refer you to an outpatient clinic, and we have no way, or you have no way of knowing how long you have to wait before you get your first appointment. So we call it the hidden waiting list. So we want transparency in that area. Alcohol, tobacco. Do you remember anything else?
I'll have to talk about it tomorrow, right?
I wrote it, but I can't remember it. Beds, ICT, that's the other one. Technology. And the Liberals have actually come out with an announcement around ICT that we thought was positive. That's the only real announcement that we've applauded at this stage. They have announced a redevelopment of Ballarat Hospital, which is a good thing, but no new beds in any of the growth corridors, but neither party has come to the party on that.
Two more questions.
The first one, I might be the only person here who doesn't know, but you mentioned the AMA is a broad-based union. Are the paramedics under
No.
that umbrella?
No, it's just doctors.
So it's specifically doctors.
Specifically
Okay,
doctors.
the other question that was brought up just beforehand was there's a constant reference to beds. When I go to hospital, there seems to be a lot of beds, and they always make new hospitals with more beds. Is it really beds or is it really staff?
It's both.
Yeah,
It's
it's
both.
better to say we've got 5 more doctors and 50 more nurses, or we've got 300 more beds that we've just built, because that's just a room with some mattresses in it.
We talk in beds because every bed, there's a certain ratio of doctors to staff that need to man that bed. So that's why one of our election issues is the state government, the current government, announced 800 new beds in this electoral cycle, and they're not releasing where the data on where those new beds
So
are.
there'll be a corresponding number of new doctors and nurses.
That's
for
right.
those
That's what we would
patients.
anticipate seeing, but at this point we can't find those
Is
beds.
that a core promise?
Oh, I don't believe she's going for a government position.
Well, my new hat.
Sorry, I did say two more, but there's one down there, but sorry, I didn't say that.
Yeah, thanks very much for your talk. I'd just like you to expand on one issue you raised there. Many people here, I'm sure, saw the four corners a couple of weeks ago with the spread of ice, particularly to rural areas, which I found very domestic. One to start taking ice as a consequence of it. But what do you think the AMA would like to see doctors about state and federal doing to stop this spread of ice?
It is a very difficult issue. We believe in public education, a lot of education. Obviously, law enforcement will need to play a part as well, but the thrust of our submission was around public education and educating kids on what it does to you.
One last question.
Thanks. AMA clearly plays a very important role, but membership has been declining nationally for many years now, certainly as a percentage of potential eligible members. Why do you think that is, and what do you think we know?
Well, it all comes down to the value proposition, and it was declining, but it's actually trending the other way now. I think it's if you know about membership, you probably know all about membership. It's like a graph. So people finish uni, they're generally not really interested. Then they have their families, and then at a later age they start to join when they have more time on their hands. And that's certainly the trend that we see at the AMA. So it's around value proposition and trying to hook people in at a younger age. We suffer from the same, just what every other association suffers from.
Thank you, everybody. I'd now like to welcome David Sparks. I would now like to welcome Keith Boyle, who probably knows Francis better, to do the closing address.
Thanks, Kerry and Francis. I think the reason I was chosen is I have been able to watch Francis's development pretty much as a graduate of the then called Australian College of Health Service Executives, and my professional life has been pretty much about graduate recruitment, even going back earlier than that. And it's always very pleasant to see a young man or young woman just progress through the ranks to leadership roles. So when I first met Francis in the 1990s, she was a graduate of this wonderful college program, and then she's moved through public hospitals. I actually worked with Francis when you think back to Women's and Children's Hospital. We're talking emerging back in the 90s, and she was working in HR, and she was an absolute pleasure to work with then. Then she moved into aged care and done some wonderful work there again in leadership roles, and now into an even more challenging role with the AMA. We've just finished the Spring Carnival, and I was interested to hear that Francis talked about the formidable group of doctors that she's really representing, one of her stakeholders, and I thought to use a racehorse analogy, maybe it's the might and power of the doctors that you might be coping with. I like the way that you talked about the key roles of the AMA, and that last issue about ice, I also saw that Four Corners feature, and I just wondered, like you did, what on earth are we going to do about that? So anything the AMA can do on the field of education, gee, that's going to be a huge step forward. Putting my executive search hat on again, when we look for leaders, we usually look at character and competence. Have they got the character to take on a leadership role, and have they got the technical competencies? Well, I think you saw in Francis all those sort of character and competency issues that came forward very clearly. And also the courage to be able to answer some of those pretty tough questions. We really appreciate the honesty and candor that you showed there. And I think this is probably the largest attendance that I can recall this year anyway for a monthly luncheon. So it's great to have you along, Francis, to share some of your challenges. And I also really like the way that although you've got a significant and very important leadership role, you haven't forgotten the importance of family. And I was delighted in talking with Frances at lunchtime. She and her husband and their 7 to 14-year-olds, 7 to 14, the three of them, are taking a holiday in January, so it's great if you can get away and enjoy it all. Come back in February and you can hear about health and happiness with our Twilight series, and everything will be very, very well. Okay, I think it's again been yet another week. We're very blessed at the Graduate Union, Graduate House, to have some outstanding speakers, and I think you'd agree that in Frances Mirabelli we've maintained that tradition. So thank you, Frances. I know you're an incredibly busy person, but it was great to have you here and talk about what you're doing and plan to do at the AMA. Would you join me in thanking Frances? This is the membership pack. She's just down the road in Royal Parade.